All right, Haeli Draper. Uh, I'm excited to have you on. This is a topic that actually one of my clients that I was working with in pregnancy and is an avid runner, very much a proactive person, and she said to me just as about she was about to have her baby, Mel, I have a topic I would love for you to cover. How do I consider nutrition in my recovery plan? Because she's just a very, as I mentioned, proactive person. And she understood that, everything's tied together. It's not just about her pelvic floor. It's just not just about her return to running, but how do I support myself in getting enough rest and getting enough nutrition to promote the best chance to get back to running successfully? And so
Mhm.
I'll admit I'm a bit late. She's already had her baby. But I thought of you right away just because I know not only you're going through your own pregnancy journey right now, but that you work in our community with the health region to provide some of this information. So thank you so much for joining me today.
You're so welcome. I'm very happy to be here. Excited. My first podcast experience. So
All
here you
right.
go.
Will you, for anybody that's listening, first just introduce yourself so that they can get an idea of who this excellent information is coming from?
Sure. So I'm Haeli Draper. I'm a dietitian, been practicing since 2014. And I've kind of dabbled in a whole whack of different areas, but I'm currently in the community working with a variety of different patients through their primary care providers. So some pregnancy related, some pediatric related, postpartum, but also chronic disease management. So kind of a little bit of everything. But yeah, in the Okanagan, Kelowna, so very familiar with kind of the systems here too.
That's great. And
Mhm.
before we hit record, I wanted to make sure that I like to picture the clients as they are sitting in front of me so that I can help give the big picture. Because keeping in mind, this podcast is called the Pelvic Floor Project. And one of the main messages I want to share with my clients is the pelvic floor is just a piece of a bigger puzzle. And sure, you're coming in to see me or talk to me about your pelvic floor, but let's make sure that we start with the big picture. And I wanted to talk specifically today about how to support our bodies in such a huge time of transition, which is pregnancy, and then a huge time of recovery, which is postpartum, and just be able to provide some people with some very important information about certain things they can consider at
Mhm.
that time for what they're fueling their body with. And so if we think about this almost like a bit chronologically and we think about the people that are pregnant, what kinds of things, well, actually, maybe if we start off by what type of people or what type of concerns are you seeing in pregnancy? Who's referred to you right now?
Yeah. So particularly within pregnancy, it can really range to people who, their experience thus far has been really smooth and they're just wanting to make sure that they're like ticking all their boxes, like getting the right nutrition, and a right amounts of different sort of nutrients to support my pregnancy. And then asking questions, obviously, like what does postpartum look like? Anything I need to know in particular for breastfeeding, particularly for people who are following like different dietary patterns. So for example, like I'm predominantly plant-based or I'm following a vegan diet. Is there anything special that I need to know? Definitely a huge um, kind of referral basis for constipation, right? And so the fact that you kind of touched on, like, yes, we can focus on nutrition, but in my role, it would also be kind of assessing things like, oh, have you ever talked to a pelvic floor physio? What are your like bathroom habits like? So you can't really touch on one thing without considering the entire picture, like you said, but definitely sort of, just making sure that we're hitting all the nutrient bases, nutrition bases, but also dealing with things like constipation in pregnancy, hemorrhoids in pregnancy, and trying to prevent or resolve those.
So if I think about, I'm going to think about a couple example clients right now for pregnancy because you're right. So quite often they would come to me because maybe they're having issues with pooping. They have pain with pooping. They have hemorrhoids. They have a hard time holding in their pee. pain with intercourse, or they often are just coming, they haven't necessarily put those symptoms together with a pelvic floor problem. They're more
Mhm.
coming because they've heard my friends told me to come. But then when I actually start asking some of those questions, they're like, oh my gosh, I never linked hemorrhoids to my pelvic floor, or I never linked constipation to that being a hard time getting a bulky stool out of a hole of muscles. And so
Mhm.
I will talk to them about the mechanics of the muscles and how to maybe connect with those muscles to allow easier exit so that there's not so much pressure or so much closure at that hole, or maybe talking about it as a sphincter. However, I can't talk about that without talking about their stool consistency. And that's
Mhm.
my where I might say, like, is constipation your norm, or is this a new thing? What are you doing right now about that? And quite often, they're taking things like magnesium. They are making sure they hydrate well. But will you talk a little bit about, because I think there's some confusion sometimes about fiber and
Mhm.
around what type of fiber am I supposed to take? And
Yeah.
I definitely am not an expert, but it sure seems that everybody's so individual in that it's a very much a trial and error thing. It's not like you can say everybody has to take this, but can you talk a little bit about, for given that there'll be lots of different people listening to this, what are generally your recommendations around what type of fiber to take?
Yeah. And so there's a lot that goes into the assessment for someone who comes with constipation. We don't just automatically jump to the dietary piece of things. And you already kind of touched on the first thing was, is this kind of new onset for you, or is this like a chronic condition or a chronic thing that you're experiencing? Is it normal for you to go 4 days without a bowel movement and then kind of fluctuate towards looser stool? Or are you consistently kind of having looser stool, like that ebb and flow sort of thing? Because there are so many factors that influence our gut health and our gut motility. So we would be asking questions like, okay, well, particularly in pregnancy, right, is a really common time for thyroid issues to kind of come up. So have you had your thyroid screened? There could be something going on with hypothyroidism there. That's kind of onset in pregnancy. That's kind of slowing your gut motility down and making you more prone to constipation. Are there any particular medications that you started since pregnancy or that you're on in general? Were you diagnosed with iron deficiency or anemia and started an iron supplement? And that's really kind of clogging you up as well. And then, of course, like, has your physical activity changed? Are you less mobile? Because we know like moving your body helps with bowel motility and really keeping things regular as well there. So if that's been impacted or affected by your pregnancy, and particularly going on to postpartum, right, that can contribute to a sluggish gut and constipation too. And then definitely, obviously, from the nutrition side of things, fiber and fluid is usually what we're assessing. They're kind of two things that work really well together, or they have to work together to help prevent constipation and resolve constipation. And so fiber in and of itself, I'll just kind of say the majority of people are not getting enough fiber. There are actually many, many different types of fiber, and it's only found in plant foods, right? So fruits, vegetables, different grains, nuts and seeds, things like beans and lentils will all be really great sources of fiber in the diet. And lots of us are to start eating enough of those. Variety of those types of foods in the diet is really, really important because there are actually many different types of fiber, and different types of fiber have different function within the gut. So for example, the fiber that you would maybe find, and different foods are also a combination of these types of fibers, but some are more predominant than others. Um, so the types of fiber that you would find in things like nuts or seeds, really fibrous or kind of crunchy vegetables, that's going to be a fiber that not only provides bulk to your stool to make it easier to pass, but also promotes motility through the gut too. So that regularity. Whereas foods like chia seeds or ground flax or apples or oatmeal are going to provide more fiber that's important in not only providing bulk, but holding moisture within the stool to make it easier and more comfortable to pass too. So all types of fiber are important for kind of promoting gut health and preventing constipation. So that's why variety is really, really important there. The average sort of recommended intake for fiber is around 25 to 40 grams per day, but that probably means nothing to people listening in terms of what that realistically looks like on your plate with food. And so the general recommendation is to aim for as much variety of different plant foods, so those fruits, vegetables, different sorts of grains, nuts and seeds, beans and legumes throughout your entire day, to really help you achieve that goal. Now, there are also fiber supplements, right, which are really popular, particularly for people going through pregnancy experiencing constipation. Probably the most popular and commonly recommended would be something like a psyllium fiber or a Metamucil, which the active ingredient is psyllium fiber. Because of the way it acts, it's very gentle. It's not highly fermentable. So if anyone struggles with irritable bowel syndrome or IBS or some of that more sensitive gut or tummy, they can typically tolerate it really well. But it, again, adds bulk and kind of moisture to the stool to make it easier to pass. It is very important that no matter how you're aiming to increase your fiber intake through whole foods or through a supplement, that you are also increasing your fluid intake at the same time, because again, the two work together. If you increase your fiber intake but not your fluid intake, it will likely lead to constipation and more discomfort. It also really depends on what your baseline diet looks like too, right? So if you're following a diet currently that's quite low in fiber, it's not going to be the best idea to overload your gut with a bunch of these really nutrient dense and fiber rich foods, because it will cause discomfort. Fiber is fantastic. Those foods are great, but your gut needs time to adapt to be able to handle that sort of fiber load, if that makes sense as well too. And so it really depends from person to person, kind of where we start in the recommendations of how to sort of increase fiber and what's going on behind the scenes. If you're someone who is chronically constipated, or you're finding that you're really like it's been 4, 5, 6, 7 days, and that's normal, and you haven't had a poop, you're really uncomfortable, distended, it's really impacting your appetite. Increasing fiber may not be the first thing that we go to, because adding more fiber to kind of that backed up gut load can worsen your symptoms too, right? So in that case, our primary goal is to get the bowels emptying and moving consistently before we work on increasing fiber, increasing fluid to promote that regularity with bowels as well.
And I can imagine, like, I can picture, again, a lot of people think that, working with a physio is completely separate than their bowel health. But I think about if you're full of stool and you're having a hard time, evacuating, like, that's going to contribute to the heaviness and pressure you feel, the aches and pains you feel, the the decreased motivation to move. And like I said, and that increased bulk will put more pressure on your bladder. You see so many people that leak is related, one of the things at the heart of the issue is constipation. And so I listen to you and think, like, absolutely so many benefits to movement and hydration and eating well. And I wonder if, would you say then, I hear you say it's such an individual thing and there's so many different ways to come at this. But if anyone's listening, it sounds like at the end of the day, you would still recommend people eat a variety of foods. And I think when you say eat a variety of foods, you don't have to eat the variety every day, but would you look at more what they eat across the week? Right. So it's not
Yes.
like you have to eat apples and celery and carrots and nuts and seeds and everything on Monday, Tuesday, Wednesday, but more that you're thinking about it in a week, would you say? Because
Yeah,
I think sometimes
absolutely.
I absolutely get overwhelmed with that. Is I think, okay, I got to get all this stuff, but then I'm like, but I'm not hungry. So I think it helps me to, almost plan my meals knowing that I'm going to get a bunch of things in the week. Is that, yeah?
Yeah, for sure. Pattern over plate always, right? Like, what are you able to consistently incorporate into your diet? It's always going to ebb and flow. And so often when we're talking about, meal planning and nutrition, we're talking in like very ideal terms, right? They fill your plate with half vegetables and choose whole grains more often and incorporate those nuts and seeds. Use plant-based proteins more often than animal-based proteins, right? For that additional fiber, right? So it's all very idealistic, but consistency and just trying your best to kind of get those foods in, yeah, across the week over time is really kind of what we're focused on, your overall dietary pattern, as opposed to, Monday, Tuesday, like individual days. Yeah, for sure.
And so obviously we've talked about this kind of from the point of view of keeping your stool soft, comfort, easier to pass. But then I can imagine too that the more variety you have in your diet, the more energy you'll have. And that's something that pregnant women always struggle with. And I come at this from the point of, if someone comes to see me for symptoms, quite often I'm recommending activity, like just not
Mhm.
just Kegels, but overall activity. How do we keep you active in this pregnancy? Because that is going to help you have less pain.
Mhm.
That is going to help your mental health, but sometimes it's an energy problem. That is the number one thing that I would say people say is, I don't have enough gas in the tank. So will you
Mhm.
speak to that a little bit? Because I don't think we always think about our food as fuel.
Yeah, for sure. And is particularly over the course of pregnancy and preparation for delivery and postpartum, right? The goal is to always be as well nourished as possible throughout those time periods, right? Particularly, I mean, of course, over your entire pregnancy, but leading up to delivery, to really set up the foundation for healing postpartum as well. The interesting thing, right, is that everybody's experience is going to be a little bit different. So it's about, okay, what can you prioritize right now? Like, yes, we want you to be eating enough calories over the course of your day for that energy. We want to ensure that you're getting enough protein over the course of your day. And of course, including a lot of really, colorful fruits and vegetables, different grains for overall health, vitamins, minerals, phytonutrients, all of that good stuff. But different people have different experiences, right? Some people feel great through their pregnancy. Their appetite's not impacted. They can remain physically active. They have no problems with sleep whatsoever. And so these things are easier to kind of prioritize and accommodate within their life over that sort of time period. For other people, it's like, I'm anemic, right? I've developed anemia. My thyroid's totally out of whack. I'm in a lot of pain, right? Like pubic bone discomfort that I'm experiencing right now, so I can't physically move. You have hyperemesis, right? Hormonal fluctuations that really impact your appetite, and just like your energy to get in the kitchen and kind of cook. So it's about working with people. Okay, what are you able to prioritize right now, and what do we as care providers sort of recognize as the gap or the thing that might make the biggest difference, right? um, and so in terms of nutrition, it is kind of brainstorming, okay, like what is the biggest barrier to you either accessing food or cooking food, taking in food? Is it your energy levels? Is it that you just have no appetite, you can't stand in the kitchen and prep food? Well, how can we get around that? Okay, are you going to have to rely on takeout more often? Are there more convenience meals that you have? Is there someone else in your life that can take over the responsibility of prepping those meals for you, right? And so really working with people to identify those barriers and trying to find solutions to them to make sure that they are adequately nourishing themselves throughout pregnancy, particularly, leading up to delivery and postpartum, where lots of those things are exacerbated.
Yeah. And I can just picture this kind of leads into some of the postpartum stuff, but I have a feeling a lot of people would think like, oh, I don't want to see a dietitian. She's just going to tell me all the things I'm doing wrong. But I think you just
Yeah.
painted this picture of, no, I'm going to help give you some information and then let's just pick away at this.
Mhm.
There's so many different ways to come at this. What feels like the low hanging fruit to you,
Yeah.
right?
And sometimes nutrition isn't the priority, right? And that's
Yes.
okay. Like sometimes
Hmm.
it's like, I just need to get a 2 hour nap in the day. How can I do that? Right?
Hmm.
That's going to make me feel better. Okay, well, then you start there, right? It's about, you're the expert in kind of what you need in your own body. And so it's our jobs as care providers, right, to work with you on that and help you along that journey to find solutions to what needs to be prioritized for you.
And so if we kind of start thinking about, approaching closer to the time to have a birth, I think you've already said really what you're trying to do is set up your body and your digestive system to be well rounded in what it eats and what it's consuming, because that's going to set you up for healing postpartum. Some of the
Mhm.
questions that, and I don't think I get them that often because people wouldn't associate me with this, but people kind of talk out loud in their sessions about maybe they have approaching C-section, and they've heard different things about, should I have a liquid diet? Should I eat certain things? Should I avoid certain things? Should I avoid a heavy meal? What would you say if that was my question? I have a C-section on March 6th. What should I eat the days leading up to that?
Yeah, absolutely. And so for the direct time period leading up to a surgery like that, right, it's obviously going to be following the advice of the surgeon, and whether that's clear liquids, nothing to eat, fasting prior to that, absolutely follow those recommendations. But yeah, really sort of, I think, again, it's multifactorial, but ensuring that you are continuing to eat those kind of well-balanced meals, getting enough in the course of the day. Protein is, of course, going to be important. Protein is one of those nutrients that we like to see spread over the course of the day, because we don't have the ability to store excess protein that we're not utilizing from that meal. So getting good quality protein, adequate hydration. I think the continuation of things like a prenatal multivite can be really important, not only throughout pregnancy, of course, but kind of leading up to that delivery or C-section and postpartum, just to fill any of those nutrient gaps, particularly with nutrients that are really important for wound healing in general. So things like zinc and vitamin A, vitamin C. But the recommendations don't really change all that much, right? Like, it's easy to sort of fixate on and read a bunch of things online, like you should do this, you shouldn't do this, liquids best. No, solid foods are best, but really just very simply, variety of different foods, eating enough, maintaining your hydration, filling in some of those nutrient gaps, maybe with your prenatal vitamin or singular nutrient supplements that a dietitian can help sort of identify the need for as well, sort of leading up to that.
So overall, eat a variety of foods, but if there's something that you really want leading into it, have it.
Absolutely. Yes. There's nothing you can't have unless you're allergic to it, intolerant to it, right? So allow yourself to enjoy all that.
What about whether it be after, maybe if you speak a little bit too. So now I'm picturing the new mom in the hospital or at home after she's had a home birth, that's had either a vaginal birth or a C-section birth, and she's wondering, what kinds of things should I really focus on in the first few days? You know, when it comes to repair of tissues and, healthy foods for making breast milk, stuff like that. I think I know your answer is going to be a variety of foods. But is there anything specific you find yourself, if you're seeing someone in pregnancy, that you say, oh, sneak this stuff into your bag, or ask your family to bring this in? Are there any go-tos that you find yourself recommending?
Not necessarily. I think within those first few days, I mean, you just accomplished something very miraculous. You delivered a baby, C-section or vaginal, whatever. And so removing the pressure off of yourself to have to focus on nutrition right away, because truthfully, like, in the grand scheme of things, just getting enough calories in is probably the most important thing for healing, for milk production, right? For supporting breast milk production, if that's something that you're wanting and able to do. So kind of removing pressure about what you should and should not be eating, particularly in that immediate postpartum period. Enjoy. But yeah, calories for sure in general. And again, it's really tricky, right, with how you get those calories in, because some people will handle postpartum beautifully with no complications or concerns, but there's a lot of things that impact your appetite and ability to actually take in nutrition postpartum, right? So the pure exhaustion, the lack of sleep, the lack of time, finding a new normal, healing from a C-section, right? So I'm assuming that your mobility and capabilities or tolerance to standing and even prepping foods is going to be really, really impacted there. Things like postpartum anxiety and depression that can set in can also really negatively impact your appetite and ability to eat. So there's also food aversions, right? Like, sometimes people just cannot tolerate solids. And so, hey, how do we get you calories and protein and these nutrients in a way that's doable? Is it soups or smoothies? Right. So we can get really tied into, these are good foods, these are bad foods for healing, but just trying to get nutrition in whatever way possible to support that healing in that immediate postpartum period should be the priority.
I love that because I think in the days of especially social media, there's all these like, you should do this, not this. Like I can picture the people saying, like wagging their finger, like, don't do this, do this. And
Mhm.
I've noticed it's really creating this conflict for people because their friends saw a different post than they did. And so, oh, my friend told me I'm supposed to eat warm foods, but I saw that I'm supposed to eat cold foods. Oh, what am I supposed to do? But I think what you're saying is don't overthink it. What do you want? Right?
Yeah, what do you want? What feels good in your body? And also being kind with yourself, because your ability to maybe have foods that you really enjoyed before or thought that you could enjoy, like you're just not able to, aversions or nausea, decreased appetite, right? There's no need to add additional pressure into the shoulds and should nots of what you should be eating or should not be eating in with diet postpartum. It's just what works for you, what feels good for you, and trying the best you can to kind of tune out the social media people or just people in general, because everyone has their advice to offer, right? To moms, not only but what they're eating, but body and movement and sleep and all of those things, right?
It makes me think of, I actually had a client the other day. It was an online appointment, newly postpartum, and I was asking about, she had had some tearing, perineal tearing, and she was quite uncomfortable. And so I obviously asked about how it is to pass stools and how she was feeling with that. And she said, you know what? I'm having a really hard time. I'm resting really well, but my lovely friends have all brought me food, but it's all like carbs and cheese, right? Like it's all like lasagnas, pastas. And she said, it's so good, but I'm not getting enough fiber is in. And so I thought that was I thought, oh, what a good tip to, you know,
Mhm.
friends always mean well, friends and family mean well. And I wonder if there's a way you can make sure that you send a variety. Like, so take that guesswork out of what they might want, or because like you said, different food aversions, different things come up. And maybe if you could almost send a bit of a variety plate or make sure it's well rounded, maybe they'll pick around it. They won't eat everything, but
Mhm.
those lasagnas and pasta dishes and everything are great, but maybe it's the fruits and vegetables and some of the different fiber options that need to be put in front of them, right?
Mhm. Yeah, absolutely. So no shame in sort of requesting that from loved ones, right? One of the best gifts people can give you is just food dropped at your door.
Yes.
So like, yes, thankful for that. But you're right, like sometimes there are things that, and that's very insightful, like I just need more fiber. So requesting that, or I mean, particularly for just like the planning phase of what your diet's going to look like postpartum and what you're able to access, right? Like, hey, can you just buy some fresh produce chopped up and drop it at the front door? Or utilizing more of those, pre-prepped fruits and vegetables, frozen fruits and vegetables, whatever it may be, in your own fridge and freezer in preparation. Like we always talk about the addition versus the restriction mentality when it comes to nutrition. So in what ways can I increase the nutrient density of this meal? So, okay, great. My family member made me this really delicious cheese and meat lasagna. It's awesome, but I recognize that maybe there's not a whole heck of a lot of fiber in that. Do I have some prepped veggies in the freezer that, or a fridge, that I could just add to the side of this, or a piece of fruit, or anything like that? Absolutely.
And I picture now, you know, we were talking about in the hospital and newly postpartum. Now I picture, you know, you've settled into routine. Maybe people aren't bringing food quite as often. It's a couple weeks after. Now it's more, oh my gosh, my baby's sleeping less. I'm breastfeeding all day, or I'm trying to figure out feeding all day. I'm just going to some of the same things over and over again. And I think if I could think of what you'll say, just get in the nutrients, just get in the food, but maybe be a bit strategic in having the variety, because I think it's, I remember a lot of kind of spoons of peanut butter, kind of like I just got to get something quick and easy.
Mhm.
But I also remember I told him I relied a lot on my husband to remember things, like that he had certain jobs, like remember to tell me to take my pain meds, and one of them was, please make sure there's also always some nuts sitting right there where I feed the baby, and please
Mhm.
make sure that you always put veggies on my plate because I don't reach
Yeah.
for them.
Yeah.
right?
Yeah.
And what would you say, any other tips for getting a variety in, as the time passes?
Yeah, you're right, right? It's like the classic, everyone kind of swarms you those first few weeks,
Yes.
and you're like deserted on this deserted island trying to figure out your new normal in like the midst of chaos with a newborn too. So I think that's really where it's so important to plan for that pre-delivery, right? So can you get in the habit of sort of batch cooking things? So whether it's your proteins or different grains, prepping different fruits and vegetables, laying out those sort of standards with like your loved one. Okay, these are the things that I need to be focusing on. Can you take over the primary role of kind of food preparation for the next little bit, just so I can focus on baby and breastfeeding, rest and sleeping and healing. Yeah, preparing meals for your own freezer, absolutely. Deciding as a family, like, okay, like there are going to be a few designated weeks or days of the week where we're going to rely on takeout. Like, what's going to be our go-tos? Like, what's the plan for that, right? So there's really no right or wrong, but you cannot go wrong with sort of planning for, again, those barriers that are so common within that postpartum period where you're exhausted, you're tired, but you don't have the capacity to kind of sit and meal plan your week out all of the time. With, okay, do I have nutrient dense foods on hand, and how am I going to kind of incorporate some of that freshness if desired, right, into your meals sort of throughout the week or month, whatever it may be.
So what about I remember I have a couple examples in mind. So I think about myself postpartum. Um, I would say that um I can't say that I was worried about weight, but I had gained a lot of weight in pregnancy, and obviously I wanted to lose it. I was I found that over time I was overeat I got used to eating more because I think I needed to at the beginning, and then I got used to eating more. So I would say that was one reason why I kept more weight on, is I just noticed I was eating more. I There's always this thing postpartum about the balance between healthy weight, producing milk, but I think that I would be silly to say people don't care about losing weight though too. And so what's usually some of the conversational pieces you have around that for people? Because I'm sure this is something that you talk about all the time, is how do people help find the balance between I'm motivated to lose weight, but I also care about my healing and producing milk and being a healthy person?
Yeah. And it's tricky, right? Because we do live in this like rather toxic bounce back culture. I think you mentioned that in our previous discussions together, like how to navigate that with this the societal pressure, right? To lose weight, to get back to that pre-baby body. Like it's just inevitable. Our bodies are going to change through this period. And some are going to welcome that with open arms. And for other people, that's going to be really distressing, right? To see and notice how their body's changing physically, like the way it appears, but also maybe the way it functions as well, right? Like particularly if you're really athletic and participate in a lot of sports and activities, like that could change too. And so the body dissatisfaction is very common and should be validated, but that's perpetuated by this like societal pressure for us to lose weight relatively quickly, right? Get back to normal, quote unquote, after we have a baby. So again, like being dissatisfied with your current body, either the way it looks or the way it functions, is really, really common. And I think that, well, one, it's really important with the messaging that you surround yourself with, particularly on social media, because it is a period where it's so easy to compare your pregnancy and postpartum experience to other people when you really never know the full story kind of behind the lens, right? Particularly with social media. So be very mindful and kind of kind to yourself with what you're seeing or surrounding yourself with, particularly where it comes to things like weight loss postpartum as well. It's really like sitting down and having the conversation of, why is that a priority for you in this moment? Like, why is that a motivation? Where is that coming from? Why do you want to get back to X weight? Right. So just kind of talking about discovering the motives behind that for any particular person, I think aside from even just the social media, weight loss in general, right, is glorified. There's a lot of, although well-intentioned comments from people, potentially also quite harmful in terms of commenting on women's bodies postpartum, in particular with weight loss. Like we tend to always praise weight loss as well. And so it's just so normalized too. But you never fully know the circumstances behind where someone currently is at with that weight loss, right? Like it could be, yeah, like I just started breastfeeding and the weight just fell off. That's fantastic. It could be that that person's really struggling with body dissatisfaction and engaging in some really disordered eating behaviors too soon. Right, as well, it could be that they're in such a dark place mentally with postpartum, sorry, anxiety or depression that they physically cannot eat, and you're praising that weight loss without knowing kind of the full history. So it's harmful and validating for that person to continue on engaging in those behaviors, which of course is going to be damaging. Of course, it's going to impact your healing, your breast milk production if you are breastfeeding as well. And so I think as a general rule of thumb, it's just a good idea to avoid commenting on people's bodies postpartum, particularly right when it comes to weight loss. Like, oh, you look so great. Like, how did you get the weight off so quickly? Well-meaning, not meant to be kind of negative, but it can be harmful, right? And I don't know if you've experienced that too.
Oh, of course. I mean, there are so many different factors here. And I think that it's something because how it presents to me is people might come to me postpartum and maybe they have symptoms, maybe that's why they're coming, whether it be I have symptoms around my private parts is usually what it is, or I'm concerned about the strength of my core, or I'm concerned about getting back to exercise. And when you start asking, well, what's meaningful when it comes to exercise, whether that be maybe part of their job, maybe they're a professional athlete, maybe they just love exercise and that's part of who they are and what they love. And for a lot of them, it's, I actually want to fit in my clothes again, or I
Mhm.
don't want to look like this. And all of them, I absolutely validate. And I think that, I always try to acknowledge that absolutely exercise is important, not just for weight loss, but for mental health, and also just to be able to keep up with your growing baby and yada yada
Sleep,
yada.
energy, yeah.
Yes, so many things. And so I can't not acknowledge when they say that they want to lose weight. I think I always validate that.
Mhm.
But I also know there's not a simple "we'll eat less" because maybe they're also struggling with milk supply.
Mhm.
And I think about I want to bring up a couple other people and then I want to come full circle to what your recommendations are. But I had a client the other day who mentioned she was very open and said, I struggle with disordered eating and I'm not eating enough. I acknowledge that. I think I'm at the point where I'm gaining weight because I'm not eating enough. And so she was definitely someone that I thought, well, let's put you in touch with someone like yourself, Haeli, because you just having some guidance, you can't find that on Instagram. You can't
Mhm.
sometimes you need someone to be able to look at things objectively with you and help come up
Yeah.
with a plan. Because otherwise, I think this is a very hard target to
Yeah.
nail down, isn't it?
Absolutely. And so it's usually the conversation will go something like, okay, well, I'm coming to see you because I want to lose weight. Okay, great. Why do you want to lose weight? Well, I just want to feel healthier. Okay, well, what does healthier mean to you? Like
Mm,
what comes to mind with health? Well, my energy levels, I feel good in my skin, I feel good in my body. Okay, that's what you're kind of after. That's the goal. It's not necessarily the weight loss, right? There has to be some recognition that we actually have very little control over where our weight sort of sits, because there's so many influencing factors, right? Particularly in that postpartum period, right? Like I know even for myself, right? Like people, I got fed the message over and over and over again, like you're going to breastfeed and it's just going to fall off. Well, that was not the case. That was not the case for me. My body was like, no,
yeah.
I just want to hold on to
Mhm.
everything, right? Um, And so really identifying, okay, like, what are you after? What's your real goal? Okay, you want to feel better in your own skin, you want more energy, you want to feel like some mental clarity. Well, how can we get there without the emphasis on weight? Because at the end of the day, weight is something that we truly can't control. So what can we control? Okay, well, one of the best things that you can do for being postpartum or just in general, right? If you're feeling uncomfortable in your body, get a good fitting bra, get some good fitting underwear, wear some nice stretchy pants that feel comfortable, wear and buy clothes that fit your now body instead of like longing to squeeze into clothing that's not comfortable. If you're not comfortable with what you're physically wearing, you're not going to be comfortable in your body. I also fully recommend throwing away your scale, not weighing yourself at all, right, throughout this period, because it generally brings up a lot of kind of guilt or shame or frustration, even if you are feeling good, right? Like, okay, I was able to get out for a walk today and that did wonders for my mental health. I feel really comfortable in my body today. I got some nice t-shirts and, a good nursing bra that actually fits my body well and feels comfortable. You get on the scale and it like dismantles all of those positive feelings, right? So dressing for your now body, engaging in some maybe other behaviors, like is there other self-care, right, that can help you feel more well rested? Do you just need to ask someone for a little bit of extra sleep so you have that sort of, rest that your body is clearly craving, right? So it's very complex, and just like you said, you don't want to invalidate anyone's desire or feelings that they need to lose weight, but we really need to kind of go below the surface on that and kind of dig into the whys. Okay, like what do you have control over and what can we implement now that will help you feel better in your body, right?
So if I go back to, because we've talked a little bit about kind of overall, for someone that, maybe is looking to lose weight, but and then also someone that feels like they admit they have some disordered eating. What if we go back to that initial person that asked for guidance or asked for this podcast to be done? I'm an athlete and I want to give my body the best chance. Would you say that you would still recommend same thing? I want you to get a variety of your food groups and a variety from the different types of fiber. And at the end of the day, if you're hungry, eat more and acknowledge that as you start becoming more active, you're going to need to eat more. Right. And
Mhm.
I think a lot of people are very confused about, and again, you can't give black and white information here. I think that, well, will you tie up then for people listening? What's the preliminary guidance and when should someone reach out for more focused guidance from yourself or from someone like yourself? What I'm asking, number one, for any listener, kind of your recommendation on, um, just takeaways, but then when to know that they should ask for more focused guidance.
Mhm. So the general recommendation, like we talked about, right? Getting a good variety, ensuring that you're eating frequently and consistently, sorry, throughout the day, even if that means that you have to remind yourself that your body deserves that nourishment no matter what, right? If there's that preoccupation, it can really range when you want to come talk to a dietitian, right? So it could be someone who doesn't have any of the concerns or like disordered behavior tendencies, that just wants to say like, hey, like I was an athlete before. This is where I'd like to get to in the future. Is there anything I have to consider for general nutrition advice? And that's going to change over time as the body heals and recovers and you build up that endurance and strength again, right? Through working with either a dietitian or someone like a physiotherapist, pelvic floor physio as well. It could be too like you're following a specific dietary pattern. So I'll just use like plant-based, for example. Like, is there anything I have to consider nutrient wise? It could also be, like you're well aware that you're coming from a disordered eating or eating disorder past, and you are concerned that, getting pregnant, carrying a pregnancy, and then the postpartum experience will be triggering for some of those eating disorder thoughts and behaviors that you previously experienced. And you just want kind of support I think in terms of that, it's really important to work with a practitioner that has experience with working with individuals with eating disorders or disordered eating behaviors, um, to be as helpful as possible with that. It could even be like, I've worked with people whose family members, right, were on the lookout for, like, they've never had disordered eating tendencies in the past, but it was this like body dissatisfaction and not recognizing who they were seeing in the mirror that was leading them towards, extreme dieting and this poor relationship with food and their body, and their practitioners picked up on that. So it's a new onset of, okay, like, how do we deal with that, working with a dietitian or counselor care provider, right, that has experience with that. And in terms of, the eating disorder eating behavior, yes, dietitians can help, but there's also points and times where it needs to be recognized that you may need additional help, registered counselor, right, psychologist to help with that as well, and that journey for sure. And so there's really a wide range of reasons why someone would want to access a dietitian. Definitely. And just like any practitioner, right? You may have a concern and you have to find the person that feels good and you can establish that rapport with and feel comfortable and trust with their recommendations and advice, right? Because there will be people or dietitians who aren't well versed in disordered eating or eating disorders, and dietitians who aren't well versed in sports nutrition and that like postpartum period, or athletes and things like that. So it can take a bit of shopping around, but we definitely cover a broad range of concerns.
And how would someone that's listening go about finding someone? Because will you please explain that? And I'm not sure if this is unique to our province or if this is nationwide, but I know that, you know, that you work for in our health, for interior health, and people can see you from a referral from their doctor. But
Mhm.
can you speak a little bit about that, and how would someone go about meeting with a dietitian?
Yeah, so there's different ways. So definitely, so I'm a part of the primary care network. So I am through like MSP covered care. So if you're attached to a general practitioner, your family physician who is attached to the primary care network, you have access to dietitians like myself, free of charge, right? And so that's something to explore within interior, I believe. And I'm not well versed. I think it's a province-wide thing. So you may just look into the search, primary care network, Victoria, primary care network, wherever you live. But it is a program that is expanding. Um, Sometimes, I mean, that's really good for the ongoing, consistent, like, follow up if there's things that we want to be working on an ongoing basis. There's also things like 811, which is a line that you could call to access a dietitian for, quick one-off questions or education or handouts. That's typically, like I said, like a one-off thing. And then there's going to be private practice dietitians as well, spread out everywhere. And typically they're more kind of niched and have specific areas of practice that they focus on. So it's easier to kind of navigate and like zoom in on specific practitioners that may be able to help you address the concern that you're wanting to talk about.
Awesome. Anything else in closing that would tie in, that we haven't mentioned, that ties in what you want to say to the big picture of kind of what the pelvic floor project is all about? Anything else that we didn't touch on that you want to make sure is said?
I don't know. I just a little thought, and this probably, it's not like a wrap up by any means, but something that just came to mind about milk production.
Mm,
I think we kind of glossed over that, but like calories, fluid, protein,
yes.
of course, important for breast milk production if you are able and wanting to breastfeed. But there's a lot, I've found I've gotten a lot of questions about specific foods that increase milk production.
Mm,
And so just a few of the common ones that come to mind, like I should be eating oats and brewer's yeast and fennel and fenugreek, and maybe using herbals, right? Like blessed thistle, I think is one, or nettle or ginger. Um, those are some of the foods and herbals that I see circulating around and get asked quite a bit about in terms of helping support low milk supply if that's a concern. Um, we don't have any solid scientific evidence to support the use of those foods for that purpose, right? So they haven't been proven with studies to help increase milk supply. Anecdotally, of course, some people are going to find that they benefit and increase milk supply, some people won't, right? So it's kind of hit and miss, but it's always a good idea to talk to your care provider, whether it be midwife, physician, or obstetrician about, okay, are these safe for me, particularly if it's like an herbal supplement that you want to start taking, but kind of across the board, there's no real evidence to kind of support that. And with the low milk supply, again, there's lots of questions that have to be asked in terms of like what's causing that for you. So is it a lack of nutrition? Are you just not getting in enough? Is it you're very stressed out? Is it the postpartum anxiety or depression that's contributing to low milk supply? Does this require a referral to someone like a lactation consultant to check baby's latch? Right. So there's so many different factors. And so we tend to zoom in on specific things, or like, I'm just going to take this supplement, it'll fix all my problems, but holistic approach. And I think that's a good wrap up, that all of this has to be considered like holistically, because there's a lot of different factors. We can't only focus on one thing without touching everything else.
Absolutely. No, I love it. And yeah, I appreciate your time. I think that it's such an important thing to think about. I feel like nutrition is one of those things that's kind of like, I give everybody breathing advice and they're breathing, yada, yada, yada. But I think that nutrition's the same. The impact is massive. But sometimes, and same with breathing, the impact is massive. It's just something that we do day in, day out. So we kind of think, oh, yes, talking about breathing, but it's same as nutrition. I think you can make small tweaks that make a big difference, right?
Mhm.
And so I find one of my favorite lines is, this isn't just about your pelvic floor. Your pelvic floor is part of a bigger picture. And for some people, nutrition is a much bigger piece of their puzzle than for other people. And
Mhm.
so yeah, I think the goal of this whole podcast journey is to help tie everything together, but please keep in mind that we all have our own puzzle, and we all have different pieces and different sizes of the pieces, and just to be thinking about it as a big picture.
Mhm. And it can be very frustrating to navigate all of that, right? Because people swear by doing one thing, or don't eat that food, or don't do that exercise, right? When it's like, yeah, like we always have these general recommendations. Everyone feels like, I feel like particularly for nutrition, everyone feels like they're the expert in nutrition, right? There are some very wacky things that we hear about. It's like, well, where did you hear that? What's the evidence for that? Because, you know, there really isn't any. But it's very, yes, we have baseline recommendations, but everything has to be very personalized, right? What works for someone else may not work for you across all aspects of care. And so you really deserve like a personalized, individualized care plan to support your journey.
Mm-hmm. I think too, I think sometimes we have to go into our common sense and really check in with ourselves sometimes. And sometimes we're doing just fine, aren't we?
Mm-hmm.
And if things are going well and you're feeling good, then don't make a mountain out of a molehill, right? But if you do feel like you're struggling, maybe instead of scrolling Instagram to look for the answer that you might not ever find, reach out for some personalized guidance.
Yeah, absolutely. Because no one, like even myself, and I'm not going to speak for you, but I'm sure you, like, no one's immune to that outside influence. Like, there's
Mm.
always those little seeds of doubt, like, well, I'm not doing that. Should I be doing that? Like,
Mhm.
oh no. Like, and then the panic ensues, and you're on this journey, right? And so no one's immune from that, but it is kind of taking a step back and looking at the bigger picture always, and accessing information from experts, within those areas.
Great. Well, thank you so much for your time, Haeli.
Thank you.